This is an instructional video on arterial puncture. Step 1. Select, gather, and assemble appropriate equipment. Step 2. Verifies, interprets, and evaluates physician's order in the chart.
Step 3. Greet patient in a warm and compassionate way and introduce self. A nice howdy will do. Step 4. Wash hands and observe universal precautions. And don't forget to put on your gloves. Next, check the patient's armband to assure identity. Also, assure the patient understands why procedure is being performed.
I am obtaining blood to evaluate how well you are breathing and oxygenating.
The next step is to assure the appropriate FiO2. If they're not on the appropriate oxygen, you should make sure that they are. At this time, there is no oxygen on this.
No oxygen for you!
Next, an Allen test should be performed for collateral circulation. Palpate the radial artery with the tips of the index and middle fingers. Clean the puncture site with alcohol using a circular motion starting from the center of the site and working outward about 1/2 inch around site. Explain to the patient what you are doing.
Next step. Prepare the syringe. Remove the needle cap safely and assure the bevel is in the upright position. Palpate the artery with one hand and hold the syringe in the other at a 45-degree angle. Next, explain to the patient to relax their arm.
Relax your arm!
Needle through and into the artery. A flash of blood appears. Blood begins to pulsate into the syringe. Once enough blood is obtained, remove the needle from site and apply pressure with gauze pad for approximately 5 minutes or until bleeding stops. Lock the needle safely into the cap. Remove air bubbles and gently rolls or tilts syringe from the side to side and mix the anticoagulant with the blood. Place Band-Aid onto the patient. Remove the needle from the syringe and place it in the sharps container. Place the cap onto the syringe. Grab label and put it on the syringe and put the syringe into the dialysis bag. Blood is placed in the bag with ice. Send it off to the lab immediately.
Take it to the lab!
Next, re-inspect the patient's puncture wound. Then, clean up the patient's area and dispose of all trash. Remove gloves. Wash hands.
Make sure to thank the patient.
Thank you!
Then document it in the chart.